in endemic area of Okija, Anambra State. In this study, we use Madonna University College of Health Sciences, Okija, as a study center. Our findings, which we published in 2007, reveal that in acute malaria, the human body responds by lowering the secretion of prolactin while elevating the secretion of testosterone and luteinizing hormone. You can see that in this chart. You see malaria subjects, and then normal controls. You see the difference, at least pictorially. That is for testosterone in malaria subjects, luteinizing hormone in the malaria subject compared to the normal controls. So this endocrine environment actually favors male reproductive function. So that's why one may expect priapism during malaria in males. Males should observe that during acute malaria, most of the time we observe abnormal penile erection. When somebody that is sick is running fever, but is having a penile erection, when he's not even interested in a sexual relation. And remember, I've already told you that this malaria is associated. Of course, we know that malaria is associated with the destruction of blood cells. So somebody who is having a disease condition that destroys blood cells is having penile erection. And penile erection is induced by blood being pumped into the penile tissues. You see the conflict. So it appears that in men in this, our malaria endemic area, they have naturally adapted to malaria infection to sustain their reproductive function through adjustment of the excretory dynamics of reproductive hormones of prolactin, testosterone, and luteinizing hormone. You see, it's an adaptation. Now, we again look at role of prolactin in intellectual function and well-being. I've already told you that prolactin is a master hormone involved in too many functions, more than 300, maintaining normal health conditions. One could quickly attribute this intellectual deficiency that we see in subjects that have abnormal prolactin secretion, just like Boltavo et al. In 2014 reported increased prolactin level and impaired processing speed in subjects with early psychosis. That was the observation. And people were wondering, some will say psychotic patients normally receive psychotic drugs, and most of these drugs elevate prolactin concentration. But studies by Henry et al. In 2012 in non-psychiatric population also suggest that increased blood prolactin induces negative effect on cognition. In this, their prospective study, Henry and colleagues examined the cognitive changes during late pregnancy and early postpartum period, and their possible association with fluctuating hormone levels. Most of the findings, they had negative linear association between prolactin levels and executive function scores, suggesting that higher levels of prolactin are detrimental to executive function abilities. And we know that during late pregnancy and early postpartum, that is when women have delivered babies, few days, few weeks, prolactin levels are their highest level to support breastfeeding. We also know that during these periods, women are under great stress. associated with late pregnancy events and the stress of child delivery. So at this point, it appears that prolactin hormone just acts as a modulator to prevent further imposition of intellectual stress on the nursing mother. In the past, some people were thinking that poor performance of women that just gave birth and you subject them to academic exercise and they begin to have a poor performance is just maybe because they had stress, without knowing that it's the prolactin that is telling the woman you are not supposed to be involved in academic exercise. You need rest. Studies by Turner and his co-workers in 2013 in animal subjects also support a role for prolactin in the modulation of non-spatial cognitive tasks. And in this their work, the induction of hyperprolactinemia, that is high level of prolactin, in male rats was associated with impaired object recognition. That is, they raised prolactin level in rats and tested the rats' intellectual ability. And they discovered that they had impaired object recognition. Something or objects they were able to recognize before, they could not again because prolactin level had been raised. And remember, I told you that we found in one of our investigations that academic exercise raised prolactin level. So the implication of these findings is that prolonged academic exercise without intermittent breaks is most likely to induce impairment in intellectual outcome, due partly at least to hyperprolactinemia effect. So when we subject students to excessive academic exercise without break, maybe that's what we used to call diminishing return. Somebody will keep on reading because he has too many exams, no rest. Then the person comes to exam and is blank. Or somebody will say, oh, I've read so much for this, but my score is not compared to my effort. This is what prolactin has done. So we as academics should be mindful of this when designing, I've said it before, when designing academic exercise or examination schedule we give to students. Now, we looked at a special aspect of electrolyte secretion in breast milk. In our effort to X-ray the role of prolactin as a universal health worker. We investigated prolactin regulatory functions by looking at the respiratory dynamics of sodium and potassium ions and the milk sugar lactose in the breast milk of Nigerian women who had 10 pregnancies and delivered their babies through the natural labor process. And we published our findings in 2004. And our study center then was the University of Benin Teaching Hospital. We recruited subjects of age range 20 to 45 years. And we obtained their breast milk samples by manual expression between 0.8 hours each day within 6 months lactation. We did a study that lasted for 6 months for this group. And we measured their sodium and potassium concentrations in each sample in triplicates using flame photometric techniques. And our results show that the ratio of sodium to potassium in the breast milk of these women was in the ratio of 1:2 in both the early milk and the mature milk. Early milk is milk women produce few days after delivery. Now, we know that daily duration of sunlight is a major factor regulating prolactin secretion. For instance, now, if I take your blood samples here, and during this time, and I measure prolactin secretion, and then you travel to US, around this time again, I take your blood sample and measure prolactin. It will not be the same because duration of sunlight here and that of US are different. Prolactin responds to such factors. Even here you are now, when you go outside and take your blood samples, when you are under the sun, it will differ. When you are sleeping, your prolactin level will vary. Even when you sleep from evening till morning, over the whole sleep period, your prolactin concentration varies. So daily duration or intensity of light affects the way prolactin is secreted in human body and the way prolactin affects body functions. So in this study, we observed that sodium-potassium ratio of the breast milk of these Nigerian women and the reference Caucasian mothers, the one we normally refer when we read medical textbooks written by non-Nigerian authors using their environment, especially in the temperate areas. Our findings is suggesting a physiological adaptation of the mammary sodium-potassium metabolic system to the tropical climate, our own climate. And it appears that the mammary gland of women here are secreting proportionately more sodium or less potassium in their breast milk in order to compensate for the loss of sodium in sweat. Here we sweat more than people in the temperate. So the body, from our findings, has adapted to our climate here in secreting sodium and potassium in the breast milk. Thus, the recommendation we normally take, particularly that of the Committee on Nutrition of the American Academy of Pediatrics, which many people here quote, and may even rely on that for clinical applications and some other applications, may not be appropriate for our own mothers here. Because the recommendation is that there will be extra sodium added to infant feed to compensate for dermal loss of sodium. And this appears to be unnecessary for Nigerian situation because breast milk presented to the Nigerian infant already has proportionately lower potassium compared to those of mothers living in the temperate region. Besides, we also observe that the obvious change in sodium ion and lactose secretion in breast milk in physiology, in endocrinology, is a significant parameter. It is an important physiological marker for the beginning of what we call stage 2 of milk secretion or lactogenesis, and the closure of paracellular pathway for sodium and potassium and lactose transport into milk, which occurs about 4th day in Nigerian women. You can see this. These points marked, the arrow is pointing at, is showing the time, the closure of the paracellular pathway for these parameters into milk. This is what you observed in Nigerian women in our studies. Thus, it is necessary to reappraise the infant mineral requirement vis-a-vis the numerous baby formula or supplements imported into the country. You know, the baby formula, all these baby feed imported here, the composition obviously not based on our own, the physiology of our mothers here, as I've told you, based on what is obtainable in temperate regions. Before I move to the next section of this lecture, I should think that it is important to mention at least 2 other studies we conducted in the prolactin regulated physiological functions. because of their importance in the maintenance of maternal and child health. One, in year 2000, for instance, we reported our findings on patterns of total cholesterol, total protein, lactose excretion in breast milk of breastfeeding Nigerian women. We published this work in year 2000. We were able to establish, among other things, that secretion of these macronutrients in breast milk of Nigerian women follow episodic, what we call episodic pattern, indicating that they are controlled by hormone. And I've already mentioned that prolactin secretion is episodic, even though I did not read that. Prolactin secretion is episodic. That is, it's not uniform. It rises and falls, maintaining a normal range. Okay. So in another work, which we published in 2002, we studied the influence of maternal nutrition, age, parity, body structure. That is how many children, that is parity, how many children the mother has gotten, the structure, the body structure of the mother, and the age of the mother. These parameters affect prolactin secretion and determines or modulates the way prolactin powers the secretion of macronutrients into breast milk. We found out that breast milk cholesterol secretion, for instance, in these Nigerian women increased as the maternal nutritional age increased and was much higher in older age groups, with the peak level in ages of 40 and 45 years. In this chart, that's the impact of maternal nutrition on breast milk total cholesterol. You see how it rises. Now, if you look at the maternal age, as the maternal age increases, we have the woman will increase more cholesterol in the breast milk. That was our observation. If one considers the role of cholesterol in the development of cardiovascular diseases, the implication for the low cholesterol level in the younger Nigerian women becomes great, because from this, when the woman is younger, mean cholesterol level is lower. When the woman ages, as she ages, cholesterol in the breast milk increases. It has long been reported, for instance, by Osborne in 1968, long time ago, that people who consume little cholesterol during their infancy develop cholesterol tolerance and are more predisposed to hypertension and other cardiovascular diseases in their adult life. Children that consume little cholesterol, they develop low cholesterol tolerance and are more predisposed to cardiovascular diseases such as hypertension during their adult life. And in our observation, we noticed that younger women produce lower cholesterol in their breast milk. So what happens to their children? And we also observed that sodium and potassium ions in breast milk decline as women bear more children during their reproductive life. As women produce more children, okay, as the sodium and potassium ions they produce in their breast milk will decline. That was our observation. So if somebody is interested in having too many children, in some climes, in some communities, they receive some award. Like I know in one particular state, let me not mention that, you slaughter a goat for them. By the time they've gotten 9 or 12, I don't know the particular number, but a high number. So when you are doing that or trying to achieve that, you realize or you remember what I've told you today, that the child at that point will be receiving lower sodium or lower minerals, particularly sodium and potassium. In the breast milk, the woman will no longer be producing adequate sodium or potassium based milk, and it's a health risk. I've already told you that prolactin got its name from the role it plays in the regulation of breast milk production. In fact, in reproductive endocrinology, this is what we say: no prolactin, no lactation. If there's no prolactin, there will be no breastfeeding. That's what I will use to introduce what I called prolactin as a master of family happiness. Excuse me. We know that prolactin level rises from late pregnancy period and reaches its highest level during the period of breastfeeding or after child delivery. We also know that during the period of breastfeeding, the normal menstrual cycle ceases. During breastfeeding, normal menstrual cycle in women ceases, a condition we call lactation-induced amenorrhea. Normally, during this period, ovulation does not occur. During the period of lactation, ovulation does not occur. The nursing mother, as a result, cannot become pregnant. Excuse me, there is language. I'm sorry. Sorry, I'm about before the system started having issues. I was saying that when a woman is breastfeeding, the cycle, the menstrual cycle, ceases. And the woman does not ovulate. And I've already told you that blood prolactin rises during that time. Normally, ovulation, as I've told you, does not occur. Physiologically, women of reproductive age ovulate at the middle cycle. That is at the middle part of their menstrual cycle. In summary, what happens is that during this period, or this middle stage, a woman's menstrual cycle is controlled by prolactin. At this point, there is what we call sudden rise in luteinizing hormone secretion. And this is what triggers the release of egg in a woman under normal condition. The woman is running normal condition. At this middle stage, there's a sudden rise in luteinizing hormone level. And that triggers what we call ovulation or release of the egg. But if a woman is breastfeeding, prolactin level is very high, induced by breastfeeding. And this ovulation ceases. Why? Because prolactin interferes with this luteinizing hormone surge. It prevents luteinizing hormone from rising. And because luteinizing hormone cannot rise, ovulation cannot take place. And the woman remains infertile or cannot ovulate. However, prolactin at a very high concentration, like I've told you, blocks the luteinizing hormone surge. Thus, lactation-induced hypoprolactinemia, that is, high prolactin level as a result of breastfeeding, confers the temporary infertility on the nursing mother, allowing some period of rest from early unwanted pregnancy after child delivery, without having to abstain or from normal sexual relation or applying some artificial or other complicated family planning methods. And this brings a lot of peace and happiness to the family. That is, a woman that is breastfeeding, she cannot get pregnant. She doesn't have to quarrel with her husband, oh, I'm not safe. She doesn't have to go and start going to family planning clinic, buying all sorts of drugs and all that in order to prevent unwanted pregnancy. Naturally, prolactin imposes that on the woman, and she doesn't have to give excuses to her husband, and then you have a peace. And you know, when the husband and wife are at peace, for that matter, the entire family is in peace. However, the situation may not be as simple as I've described, and may vary from one individual to the other according to socioeconomic status. In the past, you may have heard that grandmas will be telling their step-daughters, you young women are not disciplined. During our own time, we spaced 2 years claiming discipline. It's not discipline. They were not more disciplined than the younger women. The situation is this. In those days, protein availability was very low. It's only maybe during festive period they kill cow, they kill chicken. And of course, when chicken lays egg and they have remaining 1 or 2 eggs unhatched, they will cook for the husband. And if the woman is a good woman, the husband will give her small. That's how they get their protein. But these days, every morning you take a beverage laden with milk. You eat suya, you eat all manner and pobi and all manners of that. It's been discovered that increase in protein diet lowers prolactin level. And this is what has created a problem for the younger women these days. So when you you've told them that during lactation, you have lactation-induced amenorrhea. You don't have to worry about unwanted pregnancy. And if they believe you, and without any caution, within 3 months or so, even before the first period, the woman will be telling you, this thing is delaying. Before you know it, the woman is pregnant because ovulation has commenced earlier than expected, because the woman consumes more protein, and this lowers prolactin level, so that the prolactin-induced amenorrhea does not take place in such situation. So the prolactin-induced amenorrhea naturally is the benefit of what is termed the exclusive breastfeeding practice, and that's why it's being encouraged these days for women to engage in exclusive breastfeeding, so that they'll be able to raise prolactin level, so that it can induce temporary infertility and then confer family happiness. Thus, lactational amenorrhea, which is abbreviated LAM, is induced by prolactin level, high prolactin level, especially if exclusive breastfeeding practices are followed. Studies show that LAM can induce up to 98% effectiveness in women, and is recommended by WHO. Is one of the accepted, listed by WHO as one of the effective methods of family planning. And LAM it costs almost nothing. It's natural and easy to apply, no medication, no device needed, no interference with natural endocrine excretion, no interruption in conjugal life if it's practiced. It provides a very good method of contraception for breastfeeding women, thereby maintaining family happiness. So these are, I'm trying to show you the result of family happiness. Me and my wife. These are old pictures. My 2 daughters, happy family. This one, my 2 sons and the mother, happy in the family. And then you see here my wife and my last child admiring the dad in a Western attire. And of course, my children, you see a newborn. That's my son. That's the one sitting there. He's already a big boy. The Vice Chancellor, sir, fellow scholars, distinguished ladies, gentlemen, for the past 1 hour or thereabout, I've taken you through the depths of what I practiced and taught over the past 30 years, for which I am a professor of physiology and a specialist in reproductive endocrinology. Though the story I've just told you represents a concise account of my studies, my research experiences, professional practice in basic medicine, I intentionally left almost completely some other areas. I worked in environmental physiology, medicinal plant research, and others. I tried to let you know the role of prolactin in maintaining health, universal health, or as a universal health worker and master of family happiness. I've tried to explore the available opportunities provided by the current knowledge in endocrinology and reproductive physiology, and my direct experiences in the discipline to just let you appreciate this wonderful gift of God, prolactin, as the universal health worker and master of family happiness. I therefore invite you to join me in praising the Almighty God for making me his hand tool. I invite you to say louder, hallelujah. Thank you.
Please, another round of applause for him. Thank you very much. At least we now learn a lot from him. Personally, I now know why my second brain usually misbehaves when I have malaria. That is the interest there. So I thank you so much for revealing all this to us. And then, distinguished scholars, ladies and gentlemen, may I have the honor of inviting the chairman of unizik lecture series inaugural lecture committee, Professor Richard Uwakwe, to come forward to invite the Vice Chancellor for the decoration of the 95th inaugural lecturer, Professor Ufearo, the chairman.
children, my 4 children, Gochuku, her work condition, she could not obtain permission to come. Chagozie is here, Chibueze is here, Mesoma is here. They are wonderful children. I appreciate you. And then my departmental staff. They are so wonderful. I appreciate. And other friends and colleagues online, I appreciate. Sister Uche, you are wonderful. She trained my daughter, Ogochukwu. Yes. She's a wonderful teacher. So let me use this opportunity to appreciate you. My students, particular PG students, Chibueze is here. She's a wonderful person. And then, oh, my dean, so you've made it. Oh, I thank God. He has special space in my life, my sponsor in marriage, and my dean and the co-researcher we published together. Professor